What happens when a pediatrician who can read her own CTG and see that things are not all as they should be has an emergency C-section and has to spend 8 days on the other side of the NICU? Not as a doctor this time, but as a mum. Well, this week in Sense by Meg Faure, I'm catching up with our resident doctor, Dr Nellie Balfour. And the last time we spoke, she was about 34 weeks pregnant and she was counting down the days with huge excitement, anticipating this planned caesarean section. It did not go according to plan. This time, she's telling me about what actually happened between week 34 and birth. And it honestly is not a story that either of us expected. An emergency C-section, a baby in fetal distress, an umbilical cord wrapped twice around his neck, and a placenta that was less than half the size of what it should have been. Nellie knows exactly what every number on every monitor and every blood test means. And she could read it in her own results in real time. And she'll tell you that that knowledge did not make it easier. If anything, I think it made it harder. We talk about the 8 days that her little boy spent in the NICU and what it's like to leave the hospital without your baby night after night. And then we talk about the platelet count that Nellie, a pediatrician, was properly frightened about, and how his older brother dealt with it all. This episode is about what happens when your training and your instincts collide with your own fear as a mother. And no matter what title you hold, a new baby has a way of leveling every single one of us. So stay tuned for an amazing conversation about what happens when the birth of your baby is nothing like what you expected. And please do share this episode with someone who needs it today. Welcome to Sense by Meg Faure, where we make sense of the art and science of parenting. Parenting is grey and gritty and beautiful all at once. And my life's work as a healthcare professional is helping parents to feel more confident in a season that can feel quite overwhelming. Each episode, we share honest conversations with real mums. We dive into the science with experts, and we simply make sense of it all in very practical ways. This is your space. You are not alone. You are held. So let's unpack the journey of a lifetime with sense. Nellie, I am so delighted to have you join me again here today. We've been following your journey all the way through from pregnancy, and of course now our little bundle has arrived, and we are super excited for today's episode. So welcome.
Thank you so much, Meg. I'm super excited to talk about everything.
Yeah, it's going to be amazing. So when we last chatted with you, I think you were about 34 weeks pregnant and looking forward to the delivery of this little one, adding to your family. You already have a little toddler. Tell us what happened between kind of week 34 and his due date.
So everything seemed to be going okay. I was going to my regular gynae checkups. I've said before, my gynae is a colleague and a friend who I really trust, and she's awesome. And what I love about my gynae is she always says that, a mom's or a pregnant mom's intuition is something that she always takes seriously. So I had the issue from about 30 to 32 weeks of my baby not growing as well as he should. So our checkups were more regular, and she was doing some more tests such as Dopplers, which basically looks at the blood flow from the placenta to my baby, and all these other scans, and everything seems to be fine. So we couldn't really find the reason why he wasn't growing well. What I did have though was I had a lot of Braxton Hicks contractions, which some people call false labor. It's basically just preparing your body to give birth. But my Braxton Hicks contractions weren't just a little bit uncomfortable, they were quite painful, and they were quite regular also. So in the medical field, we know that Braxton Hicks tends to happen more at nighttime, but mine were throughout the day. So I told my gynae, and she basically told me to come into the hospital just to get it checked out. And this was at about 36 weeks when this happened. So I went into the hospital one Sunday evening, and we did what we call a CTG, which is, I know lots of women who've given birth know what it is. It's basically looking at the uterus contractions as well as the baby's heartbeat and the mom's heartbeat. It's a machine that you put onto your tummy. And the CTG basically showed that my contractions were stronger than usual. So the gynae was a little bit worried and told me that, I need to come in every day for CTGs so that we could just take a look and see what was going on, because it wasn't normal. So I basically went for daily CTGs, and the day before I was meant to have my cesarean section, that CTG basically showed that my baby was in fetal distress. And that led to the emergency cesarean section, which I'll also talk about a bit later, and everything that was found during the emergency cesarean section.
Wow. So a baby in fetal distress, does that mean that they're not getting enough oxygen, or what does it mean for the baby?
So there could be a few reasons why a baby's in fetal distress. Oxygen is one of them, but it basically just means that the baby's heart rate isn't where we want it to be. So a baby's heart rate, when they're still in the mom's tummy, between about 120 and 160, or sometimes 120 and 180 is normal. But if the baby's heart rate drops below 100 and it's a sustained drop, or the baby's heart rate is above 180, that's sometimes what we call fetal distress. So my baby's heartbeat dropped below 100 and stayed that way for quite some time.
Wow. That's been terrifying. For the level of knowledge that you have, did your heart just stop?
So that's exactly what I was going to say. I know too much, and I read my own CTG while it was happening, and it was very scary. And at that point, I phoned my gynae, who wasn't in the room at the time, and I called the nurses, and I basically wanted everyone to prepare for theater. So yeah, I read my own CTG and prepared everyone that, we need to take this baby out today.
That's incredible. And so this was obviously a very different delivery from baby number one, which was a planned cesarean section, right?
Yes, baby number one was a planned cesarean section. He was growing beautifully throughout the whole pregnancy. There were very few complications. Obviously, I've spoken about all the symptoms and signs of pregnancy that I experienced, and it wasn't an easy pregnancy because I basically went through every single symptom possible. But the delivery was very straightforward, and there were no concerns at all. So this one was very different because there was obviously the element of him not growing properly. So we call that intrauterine growth restriction. And then there was also this fetal distress that we all of a sudden found. And obviously me not feeling great towards the end of the pregnancy and having these very painful contractions, etc. There was just a lot happening. So I'm really happy my gynae told me to come in, and I'm really glad that we caught it in time.
Yeah, absolutely. So now you've rallied up your team. You've told everybody to prepare the OR room. What happens next? You get taken in, and can you talk us through just, kind of, was it a spinal block, an epidural? How did you feel? And then the birth itself.
So troops are all rallied. Gynae comes in, basically says to me, okay, you're right, we're taking this baby out today. My husband has to go home to fetch the hospital bags because we didn't take them with us. So luckily we don't live too far from the hospital. So he went home, fetched my hospital bag, baby's hospital bag, came back. It was an emergency cesarean, so they were trying to prepare the theater team quite quickly, and they did an amazing job. Wheeled into theater, I get a spinal block, which basically happens in almost every cesarean section unless you've had an epidural. The anesthetist was also someone that I know quite well and that I trust, so that was also really awesome. And the team, all the nurses and everyone, are people who I've worked with before. So, it was like a cute little family, and all of us being there together. After the spinal block, which was pretty straightforward for me. Even the first time I gave birth, the spinal block was straightforward. Then they started cutting. So when they got down to the uterus and opened it up, it turned out that my baby boy had the umbilical cord tied around his neck twice.
Oh,
so it was very tight around his neck. And it even resulted in him having what we call subconjunctival hemorrhages, so the little bleeds in the eyes because of how tight it was. Sorry. And then that explained a lot about why he remained so low and why he didn't move around a lot during the pregnancy, because towards the end, he wasn't moving as much as he usually did. So that explained a lot. And then they took him out, and thank God he cried. And he was nice and pink and he was breathing and he got beautiful APGARs of 9 and 10, but his birth weight was tiny. He was 2.045 kilos.
Wow.
Yeah,
That's
which is
very
even
low.
smaller than we had anticipated. But in the hospital setting where I gave birth, sorry, if a baby's above 2 kilos, they're more than happy to send baby to mom and then they just monitor. But again, with the extensive knowledge that I have, I anticipated that because of his low birth weight, his sugars would be low, his blood sugars would drop. And lo and behold, that happened. So he fed very nicely, but he had sustained low blood glucose. And then that was the reason why he had to be admitted into the neonatal ICU. He had to be put onto a drip and he had to be given regular feeds and, feeds where we knew exactly how much we were giving. And yeah, he went straight to the neonatal ICU about 2 to 3 hours after I gave birth.
Wow. So in an ideal and planned C-section, we had spoken about when we chatted last time that there would be delayed cord clamping, baby could come to the chest. There would, could any of that happen or did plan B kick in?
Luckily, it happened because he was breathing properly, right? So the only time where we don't do delayed cord clamping or baby can't be on mom's chest is when there seems to be an issue with the baby breathing and the APGARs are low and we need to resuscitate or give oxygen. So luckily, he could still, do all of that. So they did do delayed cord clamping, which I had asked for, which was amazing. And then after they had dried him and made sure that he was fine and wrapped him up and he was nice and warm, then they brought him over. And even before he went to ICU, I'd actually asked them if he could come to me in the maternity ward and then I do some skin to skin. So luckily all of that happened before he went to the neonatal ICU.
Very interesting. Sure. So now he's in the NICU. And I mean, that's a whole different experience because you have got years of experience of being on the other side of the NICU as a caregiver and a pediatrician. So what did it feel like? I mean, is it scary? Is it a place where, I know for you it's so familiar, but what is it like for mums?
So it was it was weird for me because I know the whole team working in the ICU because I've worked with them for years. I love and trust the pediatrician who was in charge of him. But it was scary because again, I know too much. And that's difficult. So I would say the first 2 days were scary because when he arrived in the ICU and they took blood from him, they also found that his platelets were extremely low. Yeah. And for me, I know what low platelets mean in babies, particularly small babies. It can mean bleeds in the brain because platelets help the blood clot. So if you don't have enough platelets, your blood doesn't clot properly. So usually we want platelets to be above 150 and my baby's platelets were 11.
Gosh,
So,
Nellie.
I know. I know. There was a lot that happened. So his platelets were 11. And the peds came to tell me and we were both confused and we were like, why would they be so low? So a whole lot of tests were done on him, a whole lot of tests and everything came back absolutely normal. And we basically attributed the low platelets and the low glucose and the intrauterine growth restriction to the fact that over time, while I was pregnant, and he was in the womb, there basically just was chronic stress and chronic hypoxia, what we call it, which is basically not getting enough oxygen. Turns out, and my gynae came to inform me that my placenta was less than 50% of the size that it should have been. So it was tiny. And a reason to why it could have been so small is because near the end of the pregnancy, she thinks that I had preeclampsia. But it was a compensated preeclampsia. So basically what that means is when I would come in and get my checkups and we do one blood pressure reading, that one was normal. But sometimes when I would come in and we do blood pressure readings, they would be high and I did have protein in my urine also. So she basically thinks that it was towards the end of the pregnancy and that my body compensated quite well in that it didn't affect me, but it affected my pregnancy and the baby. And as a result, my placenta was tiny. And as a result of my tiny placenta, my baby didn't grow well and didn't get enough oxygen. And that's why he was small, and that's why he had low platelets and low glucose.
It's such a mishmash of kind of symptoms and signs. And for the average mom, none of it would mean anything, to be honest. I mean, if my child had platelets of 11, it wouldn't have meant a thing to me. But for you, that must have actually been terrifying, because I can hear just in what you're saying is that you were pulling each thread of this and trying to make sense of this puzzle of like, where has this come from? What does it mean? And of course, as a pediatrician, your brain probably goes to all sorts of other, even more ominous syndromes and conditions with babies. When you've got a significant cluster of signs, that's when you do start to try and unpick it. So very, very complicated to be a medical professional and have this actually happen to you.
Yeah, incredibly complicated. What I did appreciate, though, was that my colleagues, especially my son's pediatrician, was very open to having suggestions from me about what we should do. And she also was great at communicating further blood results and test results. So luckily, none of the very scary and significant conditions were present. We had ruled most of them out, which really did put me at ease. So I think after day 2, I think on day about 3 or 4 of his ICU admission, I managed to calm down quite a bit. On top of that, I was able to mobilize and go and see him in ICU. So I think seeing him made me feel much better. Also, his pediatrician had said that he looks nothing like his blood results. So his blood results were very concerning, but he looked great. So that also made me feel much, much, much better. And yeah, basically breastfeeding was easy for me again, like the first time. So I managed to breastfeed quite well. And since he was a term baby, he was exactly 37 weeks when he was born, he was able to suck beautifully. So he breastfed from me really well also. I think the difficulty started again when I got discharged, because then that meant I was going home without a baby. And that meant that I was leaving him in ICU and I couldn't just go around the corner to see him whenever I wanted. And then that also meant that I had to keep coming in and out of ICU to feed and to check on him. And at nighttime, when he wasn't there with me, I couldn't particularly call ICU and check, how's he doing? Because I also wanted to separate me from being a mom and being a pediatrician. So I tried to just be a mom as much as I could and try to leave the peds part behind. And that was really difficult too.
Yeah, and let's talk about that mum part, because that is a common thing for our mums now, that and particularly as there are increasing incidents of premature deliveries, many of our moms have to leave hospital without their baby. I mean, that must be very, very difficult.
Yeah, it was incredibly difficult. And I didn't think it would be as difficult as it was, because as I said, being on the other side of the neonatal ICU where I was the doctor and stuff, and we'd say to the moms, no, don't worry, mom, he's in good hands, leave him here. You can come through and visit him whenever you need to. He's safe. Being in hospital is the best place he can be. Very different to when you experience it yourself. I mean, having grown someone for 9 months and then leaving them in the hospital and going home on your own is very, very difficult. So it wasn't like I thought it would be. I thought maybe I'd be more equipped because I've worked in the ICU for ages and I've counseled parents and spoken to them. But it's a completely different ballgame when it's your baby and you have to leave them in the ICU. It was actually very, very difficult. It was. And obviously for obvious reasons, but I think also a combination of hormones, and I've just given birth and, all of that stuff. And then his brother's asking where he is. And when people come and visit, they want to see him, but they can't. And yeah, it was very difficult. And yeah, it was just a hard time.
Today's Dose of Sense is brought to you by Parent Sense, the expert-based parenting app that gives you daily support from pregnancy to sleep feeding and daily routines. Take the guesswork out of parenting by downloading the Parent Sense app today and use the code SENSE50 for 50% off. So, little bit more detail about our little one. How is he doing now, and what is his name?
So he's doing very, very well. He was discharged after being in ICU for 8 days and we could take him home, and it was very exciting. His platelets have recovered completely. They're now 241, which is fantastic. And his
Brilliant.
blood glucose is on normal and he's gaining weight. His older brother is obsessed with him, which we love. And we weren't anticipating that. We thought it would be a really difficult transition, but he loves
Yeah.
him and he gives him 100 kisses a day, every day, which is great. And the little one's name is Uyakile, which basically means, if you put it in a full sentence, basically means, God, you have built our family.
Oh, I love that. Absolutely love that. And was that a name you had before he was born, regardless of the hard journey he had?
Yes. So it was a name that we had in mind before he was born. And I think it was just so fitting after everything.
Yeah.
So we were very happy to
Absolutely.
have him at home with us.
Amazing. So I wanted to swing around on an emotional level. All mums go through anxiety after their babies are born. And I think part of that is because our prediction models fail. The things that we knew before then don't materialize, and we don't know how to actually code for predictability in this new scenario. And that's particularly true for first-time mums. You, of course, had this a second time round as well now, because your prediction models were failing again. And in fact, the only prediction models you had were actually not really giving you a fabulous picture either.
Yeah.
Was anxiety straight afterwards something that you felt like you really navigated more acutely, and how are you doing now?
So strangely enough, I'm not as anxious this time as I was I think because I've been through this before, just in terms of having a child. Obviously, not a child that's been through as many challenges as my second one has. But I'm not as anxious. I think the only anxiety that came with everything was obviously him being in ICU and is he fine? And what are his blood results and all of that stuff. And then when it came to taking him home, the only anxiety was, will he be okay at home? Are his platelets still fine? Because we had to go back for a peds checkup a week after his discharge. And that's only when we found out that the platelets were normal. And another anxiety that I have is my 2-year-old bringing back, weird and wonderful bugs from preschool.
Of course.
Yeah, which is why I insisted on giving as much breast milk as possible, just to help his immune system. And also we vaccinated our little one with the RSV vaccine just before he left the hospital. So at least he's covered for that. And then in terms of my immunity, I'm almost immune to like everything, considering my job. The bloods that were done on me during pregnancy show that I have immunity against a lot of different things. So that's
Very
pretty much the
interesting.
only anxiety that I've
Yeah.
experienced.
Let's just spend a moment on that. The RSV vaccine, we spoke about that when you were pregnant, and you were saying that that's really is recommended now, it's for pregnant women to have the RSV vaccine because they can convey some of that immunity to their little ones. I actually wasn't aware that we do the RSV so early on. Is that becoming standard?
Yeah. So I stand to be corrected. I think babies born between April and June are usually born between the RSV surge season. So those babies are offered the RSV vaccine basically when they are born in the newborn period. It can also be given to the mom when she's pregnant, as we've discussed before, because that also gives some immunity to the little one. Unfortunately, I wasn't able to get vaccinated in time. Also, I was quite sick from my 2-year-old. So every time I tried to recover, I would get another bug. So it was just difficult to get that vaccine too. So yeah, we do tend to vaccinate in the newborn period, especially those babies born between the RSV surge season, which is between April and June.
Very interesting. So how old is he now?
So now he is 3 weeks. Yes, he's 3 weeks old and he's gained some weight, which is great, but he's still tiny, which is why I still am a little bit anxious about him getting any viruses or bugs or bacteria. But yeah, he's 3 weeks and 2 days today.
Interesting. And how's the feeding going? Are you exclusively breastfeeding? Are you supplementing his feeds? And how's the journey been?
Yeah, so I'm supplementing his feeds. So I am breastfeeding. So he drinks straight from the boob, pretty much 80% of the time. And then when I get time to express, I express some breast milk. So he'll drink that from the bottle, in addition to having a little bit of formula also. He drinks a lot. and I'm unable to keep up with his needs. And that's why I'm supplementing a little bit with formula. Also, just to give dad a bit of a chance to bond with him also, so he can feed him when he wants to and all of that stuff. So yeah, I'm doing both breast milk and formula.
Okay, excellent. Sure. So you really have taken us through the kind of the really hard journey that you guys have had. And he was in for 8 days, which means he's only been 2 weeks home. Is he starting to make any eye contact or not quite yet? Because that would be the only milestone we'd really be looking for.
Yes, so he is making eye contact, particularly if we get closer to his face, because, I mean, as you know, and a lot of people know, newborn babies can't really see more than about 20 centimeters past their eyes or their faces. So he does make eye contact, which is great, and he responds to sound, which is good. And yeah, we're just very in love with him, and it's a very exciting time.
It's a very, very precious time, Nellie. Well, thank you so much for sharing your journey. It is just, yeah, I mean, it definitely shows that journeys can take a course that we don't always predict or think could even possibly happen.
Yeah.
And for all of us, you know, I remember when I was pregnant with my third, I got an email from a mom to say, oh, you know what, Meg, you've written all the books, you've got 2 children, this is going to be so easy for you. And honestly, it wasn't. I mean, she was of my 3 children, she was my only C-section. And she got hectic lactose intolerance. I mean, to this day, she gets very ill when if she has any kind of mammal milk, food or cheese, or, I mean, she just can't eat it. But up until that point, back in those days, every second baby was getting diagnosed with lactose intolerance. And I was a little bit of a cynic, and I would say, it's not lactose intolerance. It's just that their lactase in their gut is not keeping up with the quantity of lactose. And so so I had all these reasons for it. Anyway,
Yeah.
and she kind of rewrites the book for me and has actually done that her entire life. We're very, very close, but she has really always marched to her own tune. And I
Yeah.
can remember thinking at the time that motherhood is such a leveler. It doesn't matter that you're a pediatrician or an occupational therapist, an author, or have never seen a baby in your life before. Every new baby brings its own set of anxieties for moms, and it levels us.
It does. And I love that you said it's such a leveler, because I think a lot of people come to me as a pediatrician and they're like, oh, but it must be much easier for you because, you know a lot. And I don't think it's easy at all. Because yes, I know a lot, but that also comes with its disadvantages. But I just think that it definitely puts us all on the exact same level, and it connects us and it bonds us. And I think that that's really awesome. We tend to have like a running joke in the hospital between all of us doctors that, of course, a doctor's child is going to be the one with all the strange things happening to them and needed admission, all of that stuff. So yeah, it tends to happen, and it happened to me. And yeah, I'm just an example of that.
Yeah, absolutely. And I can remember I had a wonderful pediatrician who you may have come across, Dr. Viviji. He would be older now, but he was a great pediatrician in the Western Cape. And I really don't like hospitals. So I'm with all my children. I discharged myself on day 1 with the 2 vaginal deliveries, and with the C-section. I called in the pediatrician, called in the gynae, and I said, listen, guys, I'm not staying here more than 2 nights. I am out. So they allowed me to be discharged early. And the pediatrician said, okay, but they'd all have to come and visit me at home, which they did. The gynae came for 3 days, and the ped came. And one day when he came around, he said to me, you know what, Meg, it's just right that you had a C-section, because you can't be in the position that you are advising people and, connecting with moms if you actually haven't walked every walk. And so that was what Em did for me. She helped me to walk a very different journey. And it's you definitely learn along the way, and your empathy grows as well.
Yeah, and I think that's something that's really important. So my empathy grew already with my firstborn, but I think now it's just grown exponentially considering everything that I went through with my secondborn and the ICU admission and all of that stuff. Like, I understood how difficult ICU was for parents before, but now I've experienced it, so I can talk them through that too. And I just have a deeper understanding, which I'm appreciative of.
Yeah. And, I think that is a gift, because I think, I often think about why it is that I still, much older now, can actually really connect with moms and the real issues. And it's because I have a very deep connection with what happens to us as mothers when we become moms, and I've never lost that. It could be like yesterday. I can tell you how I was feeling after the birth of my firstborn.
Yeah.
I've never let go of that, and it's made me a better author, a better clinician for it. And this will make you a better clinician, because when you're facing prem babies, your perspective is completely different now, and when they are looking at you with huge eyes, when somebody mentions a platelet number, you'll know what that feels like, and how
Yeah.
actually more information for you became the thing that helped quell your nerves. And often what people do need is more information and to be held so yeah, I think it'll be a gift for you.
It will be. Thank you so much, Meg. It will be.
Excellent. Well, Nellie, we will catch up with you again. We definitely want to track his development. And thank you for sharing your birth story. Really quite a remarkable story.
It's a pleasure. Thank you so much, Meg, for just giving me the platform, because it's really nice to talk about it also. And I know this will reach other moms and it'll speak to them too. So thank you.
Pleasure. Thank you very much. Thank you for joining me today. I hope that today's conversation has brought you a little more clarity, calm, and confidence on your parenting journey. We'll be back next week with another episode, same time, same place, and always here to support you. And in the meantime, download the Parent Sense app and take the guesswork out of feeding, sleep, weaning routines, and everything in between.